The three stages of learning are the cognitive, associative, and autonomous. First, the cognitive requires a high level of attention. The patient develops an understanding of the task at this stage. Performance is usually pretty variable since they're learning how to do it initially. You usually have to learn and do some trial and error and kind of fail in order to succeed. Try to just feel your way out of things. During this stage, there's a lot of verbal instruction from the physical therapist. There's a lot of manual guidance from the therapist, and there's lots of extrinsic feedback from the therapist. At this stage, patients are expected to, like I said, make mistakes and learn from them. In this stage, you also maintain the same environment, preferably, so that the patient can become more comfortable and refine, just initially learn and start gaining a skill set in the same environment. So you're not changing the location, or you're not changing the equipment you're using. It's all the same. And the second stage is the associative stage. In this stage, there's a medium level of attention. The patient is becoming more fluent. They're improving at the task they're learning here, so it requires less attention from the therapist. Like I said, they're refining the task, they're refining the skill. They're improving their coordination and their efficiency at the task. They're becoming more. They're providing more consistent performances. The treatment can be enhanced at this stage by video self-assessment, where the therapist videos the patient performing the task, and they can evaluate themselves. Also, at this task, there's slightly less verbal cues, since the patient is becoming more fluent, just becoming better with the task at hand. There's less verbal cues. The patient, the patient should be steadily improving at this stage. Like I said, they're understanding the skill movement. At this stage, the physical therapist changes their feedback due to the patient becoming more refined in their movements. The third level or learning strategy is the cognitive. At this stage, the patient is able to be pretty independent in their movements. They're quite fluent. They're quite refined. The physical therapist, at this age, will continue to modify the environments, the feedback. They'll even ask the patient to multitask, and the patient will be able to multitask. At this stage, they're quite good at the skill or the task. The patient will be able to automatically perform the movement, without much instruction or reminders or anything like that. This will require a low level of attention from the therapist. They have the therapist will feel a lot more comfortable with the patient performing this without much oversee necessarily, or much instruction, or much worry that the patient will be doing the task or the skill properly. Essentially, the patient is quite good at the task at this point, and quite comfortable as well.